Hi guys, Dr. Kid here. In this video, I'm going to review the medication Vortioxetine, otherwise sold under the brand name Trintellix, previously known as Trintillix. What I'm going to cover is how Vortioxetine works and how it differs from other SSRIs, some of the potential cognitive benefits it may have, not seen in other antidepressants, how to take it for the best results, and what are the key side effects to look out for. So what is Vortioxetine? Well, Vortioxetine is a relatively newer antidepressant that's gained a lot of attention because it has lower side effects and potential cognitive benefits. So how does Vortioxetine work and how does it differ from other traditional SSRIs? Let me use a simple analogy to explain the difference. Imagine your brain's serotonin system as a sound system. Standard SSRIs like Prozac and Zoloft work by turning up the master volume. They block serotonin from being reabsorbed, leading to more serotonin being available in the brain. Everything gets louder across the board, and this can be simple and effective for some, improving their depression. However, for other people, it can be too loud, leading to side effects, so it's not very well fine-tuned. Vortioxetine takes a different approach. Yes, part of what it does is like turning up the master volume, just like SSRIs, where it blocks the reuptake of serotonin, but it also acts like an equalizer with multiple dials. It adjusts individual frequency bands by modulating different serotonin receptors. It boosts some receptors, turns down others to create a more balanced and refined sound. Some of the receptors that Vortioxetine fine-tunes are listed here. This complex action means that Vortioxetine doesn't just increase serotonin in the brain, it shapes how the serotonin signal is received throughout the brain. This matters because with this fine-tuning ability, you can target not only serotonin, but also different receptors like noradrenaline and glutamate, and this allows for not only less side effects, but also targeting the specific symptoms that you want to treat, such as depression, anxiety, and even cognitive enhancement. One of the most interesting aspects of Vortioxetine is its potential cognitive benefits. Research suggests that it may improve processing speed, executive function, attention, learning, and memory. What's particularly notable is that these cognitive improvements are at least partially independent of the antidepressant effects. This means that the cognitive benefits aren't just happening because the depression is lifting. There seems to be a direct effect on cognitive function. The cognitive benefits are thought to come from Vortioxetine's effect on glutamate transmission in the prefrontal cortex and the hippocampus, both regions of the brain that are crucial for executive function and memory. So how do you take Vortioxetine? Well, Vortioxetine is a once-a-day tablet and is taken with or without food. The dosage ranges between 5 and 20 milligrams. The typical starting dose for most adults is 10 milligrams, but if you're elderly, you may like to start with a 5 milligram dose to be safe. The full effect of the medication may not occur for at least 2 to 4 weeks. Therefore, it's important to take the medication for 4 weeks before considering increasing the dose of the medication. So what are the side effects? The most common side effect by far is nausea, and typically this occurs mostly in the first 1 to 2 weeks. Fortunately for a lot of patients, after a few weeks, this nausea tends to go away. Other side effects include constipation, dizziness, and dry mouth, but what's notable is that compared to traditional SSRIs, there seems to be much lower rates of sexual dysfunction and emotional numbing. There are 2 other special considerations that you should be aware of before you take Vortioxetine. The first of which is that there may be a slight increased risk of bleeding, therefore you have to be particularly careful when you're taking it with non-steroidal anti-inflammatories, aspirin, and blood thinners. The other precaution to be aware of is something called serotonin syndrome. This is often a medical emergency and is a condition where patients can experience symptoms of very rigid muscles, labile temperatures, tremors, and sweats. This condition can occur if there's too many medications that are taken that increase serotonin. So Vortioxetine is one medication that increases serotonin. If you take something else like another antidepressant or even certain painkillers like tramadol or tapentadol, this can increase your risk of serotonin syndrome. So that's my concise summary on Vortioxetine as an antidepressant. If you found this video helpful, don't forget to like and subscribe to the channel. It will really help me out a lot. If you want to learn about another antidepressant medication that has virtually no side effects, check out this video here on agomelatine, and I'll see you in the next video.